So one of the most common causes I see in shoulder pain, in addition to rotator cuff tears, is arthritis in the shoulder. It's two different causes of pain in the shoulder. Arthritis is when you lose the cartilage in the joint. And there can be several different reasons for arthritis. The most common is osteoarthritis, which is when you just lose the cartilage in your joint with just time and use of your shoulder. And a lot of this is genetic. So we're finding out more and more about the genetics of arthritis. And most of the time, if you look in your family history, you know, your parents or your brothers or your sisters will have arthritis. And a lot of times when I see people with shoulder arthritis, they have arthritis in other areas in their joint. And I explain arthritis to patients as you think if you have a certain amount of tread on your tires with your life, and when you lose that tread on your tire, that's what arthritis is. You're losing the cartilage or the coatings of your joints that allow them to glide and move smoothly. So the most common is osteoarthritis, which is the arthritis we think of getting with age. You can also get it from certain diseases like rheumatoid arthritis. You can get arthritis from having a fracture or some sort of injury to your joint. But most commonly, the reason is with osteoarthritis. And it doesn't have anything to do with what you did in your life. More commonly, it's just something that happens as we age and with time in our bodies. And if you want to look at some models we have here, so if you want to look at a regular shoulder joint, like we see here, has a nice smooth surface here. Okay, you have nice cartilage ends to both the ball here and the socket. And then someone with arthritis, the inside of their shoulder looks more like this, where you see the roughened surface and you get these bone spurs, or we call them osteophytes, on the edge of the bone, and it causes a very rough, painful joint that causes a lot of inflammation, pain, and stiffness. And so the treatment for this, typically we start with conservative things like medications. We can do injections, and if I do an injection into the joint, I'll use an ultrasound machine to make sure that I get that medicine exactly where we need to go. And all those things that we can do to help treat your pain, but it really doesn't change the arthritis itself. We're just trying to give you a less painful joint. If those things stop working, then the next step is a surgery that I specialize in, which is a shoulder replacement. And there's two types of shoulder replacements. One is a reverse shoulder, which is actually where the anatomy is flipped. And so where there was a ball, we have a socket, and where there was a socket, we have a ball. This implant was developed in France in the 1980s in order to help create a shoulder replacement where people that had arthritis because they didn't have a rotator cuff, which is another form of arthritis. But what we found is that it can actually be used in people with standard forms of arthritis, like osteoarthritis, if the pattern of wearing your bones is such that a normal shoulder replacement would wear out. And if you look, this is the reverse shoulder replacement. The standard shoulder replacement is actually the opposite, or just like your anatomy. And what you have is a metal cap on your humerus, if you imagine your humerus here, articulating with a socket that's a plastic socket here. And if you choose to have an operation for your shoulder, undergoing a shoulder replacement, whatever pattern you have of arthritis, the condition of your rotator cuff, and several other factors will go into choosing whether or not you get the standard shoulder replacement or the reverse. The good news is nowadays that the implants and the techniques have evolved such that it really doesn't change much for you as a patient from an outcome standpoint. You're going to get a great outcome regardless, typically. It just changes what the surgeon does intraoperatively. So if you have shoulder arthritis, there's obviously a lot of things we can do to treat you without an operation, but if you choose to have an operation, fortunately we have a very, very good option in either the reverse or the standard shoulder replacement to help improve your pain as well as your function.